Hi everyone, welcome to this month's version of Chiefs Conference. I'm Dave Ryan, the Chief of Hemonc here at Mass General, and I'm with Tim Graubert, who's our new Program Director for Hematologic Malignancies. And the purpose of today's conference is to introduce Tim to the Cancer Center community and the world at large, and we're going to tell you a little bit about Tim and have a discussion about his program and where we're going. So Tim trained at Harvard Medical School. In fact, he did his clerkship right down the driveway here at Massachusetts General Hospital, and then he went off to Yale to do his residency, and then WashU, where he did his fellowship and then his postdoc in Tim Lay's lab. And he became one of the world's experts in leukemia, sequencing leukemias, understanding what's behind them from a molecular standpoint. And we feel incredibly lucky to bring Tim to the MGH. And Tim, why don't you tell us a little bit about your lab and what's been going on?
Sure. Well, thanks very much, Dave. I had a wonderful series of colleagues and opportunities at Washington University for the past 20 years, and I'm very grateful for that experience. But I couldn't pass up this opportunity to come to this amazing institution and continue some of the research that I'm doing, but also take advantage of other opportunities. My lab, as Dave mentioned, is interested in the genetics of leukemias, especially AML and myelodysplastic syndrome. And so in my lab in the Navy Yard in Charlestown, I'll be continuing that work, trying to understand basic mechanisms of leukemias and learn how some of these new mutations that we're detecting in leukemias contribute to the initiation, the progression of those diseases. Hopefully that work will lead to new tools to make diagnoses and risk stratify patients and come up with new therapies for these patients.
So Tim, what is it about the world of hematologic malignancies and the world of the MGH that you saw so much, I guess, synergy between the two and really attracted you to the program?
Well, I saw a great opportunity here. First of all, there's already established an world-class clinical program here across Hemonc, including heme malignancies, where we have outstanding clinician investigators working in lymphoma, myeloma, leukemia, and bone marrow transplant. So the system wasn't broken. It was already functioning at a very high level, providing outstanding patient care. But there was the opportunity perhaps to take it to the next level. My colleagues in the solid tumor program here have really paved the way and are really leaders internationally in many respects in terms of identifying new opportunities for targeted therapy for patients with solid tumors like lung cancer and breast cancer and melanoma. And I just thought that we were very well positioned to capitalize on all those strengths here and bring these kinds of opportunities to patients with blood cancers.
So can you tell us what you're going to be studying in your lab? Are you all set up already in the Navy Yard?
Pretty much. Still a lot of boxes that haven't been unpacked yet, but we are up and running. I've hired a few people, and the pipettes are out, and we're working. So as I said, I'm mainly interested in basic mechanisms of leukemias like AML and a disease called MDS, or myelodysplastic syndrome. There are two main projects going on in my lab right now. One studies families where multiple individuals within a family, biological relatives, develop MDS or AML at a young age. So these are inherited syndromes where individuals inherit a gene or genes that predispose them to develop these cancers and then acquire additional mutations at a much younger age than typically we see in patients with MDS and AML. So these are rare syndromes, but very informative, have taught us a lot over the last few decades. But there are many remaining unanswered questions. In some families, we don't know what the gene is that they inherit that causes their predisposition, in about half of the cases, actually. So there are genes out there that we need to discover. And we also don't know much about those additional mutations that these people acquire during their lifetime that cooperate with the inherited mutations. So I've been fortunate, with the generosity of colleagues around the country, to have a very large repository of families and samples from these families that allow us to study the genetics of these familial MDS, AML families. The other major project in the lab studies a particular class of mutations that we and others identified in patients with MDS and AML that involve splicing, this process that all our cells utilize normally, but we and others found mutations in the actual splicing proteins, and they're very, very common in patients with MDS, also seen in AML and in several solid tumors as well. It's very early days, and there's a lot of work that still has to be done to try to figure out how these mutations are contributing to these cancers, and again, perhaps whether or not they might represent opportunities for new therapies. So those are the two main projects that I'm working on right now.
And how about programmatically? Give us an idea of which directions you might decide to turn the ship a little bit.
Well, I think a natural extension of the work that I've done, kind of basic research in the lab in identifying mutations, understanding the genetics of these tumors, a natural extension is to now bring this knowledge to bear, bring it back to patients, and move from discovery laboratory studies to actually translating this and helping patients. And so there are a number of things that need to happen to make that work. And again, fortunately, this institution has a lot of the infrastructure already in place. So one thing is to, one piece of this infrastructure, this pipeline that's needed, is to actually collect very high quality samples from patients. And it's my plan that we do this for all of our patients with blood cancers, that we collect high quality samples from all of our patients with blood cancers that can be used for discovery, but also for translation of information into patient care. So we've been working a lot on this tissue banking in the heme malignancy group over the last several months. The second is to develop strategies for rapidly getting that genetic information, and so I've been working with our colleagues here to develop higher throughput, fast turnaround tests where we can rapidly get the genetic profile of genes that we think are important for these cancers, again, for diagnosis, for risk stratification, and for therapy. So that's the second piece. And then the third that I'm working on, I think is very important, is to take advantage of the amazing intellectual capital that extends across the city, the other Harvard-affiliated hospitals and places like the Broad and MIT, to really try to put our heads together and work together on this problem of understanding the genetics of these tumors and figuring out ways to get that information to our patients, design good clinical trials, and advance the care of these patients.
Well, as you can see, we're very excited at the General to have Tim join us. While his lab's over in Charlestown, his office is here on the second floor of Lawrence. I can attest that it's always open. Come by and welcome Tim, and it's I think the dawn of a new era in hematologic malignancies at the MGH Cancer Center. So thank you, Tim.
Thanks very much, Dave.